testing, that test, we can either do both tests, or yes, we would just do the influenza test. But the intent wouldn't be that if we got a positive influenza, but we were still concerned, the test wouldn't necessarily be sent off. That's a provider's decision.
And then you need to do
This and back
It's a emergency medicine.
So don't put this.
28 plus years of experience.
They are. They're on your workstation.
All right. Yeah, I think that's those are the specifics that we would like.
Equipment and supplies right here. I just.
So I need to put the rapid foods up here.
We set up that tent outside of our emergency department, as I described earlier, to enable us to be able to rapidly and efficiently and effectively take care of a number of patients who really don't need full treatment services in the emergency department, but rather need to be assessed by a healthcare provider and, if necessary, tested. And so that's what that tent is really there to serve, because we knew that we'd be having an influx of patients who only need that level of care and that level of service.
I'll bring you down the floor. It's a high level.
The other advantage to having the tent outdoors is that it helps with some of the infection control measures that are necessary with this coronavirus. So as the CDC has been recommending, there's necessity to have personal protective equipment of a certain nature. There's a necessity to have patients who are suspected in certain type of rooms, what we call isolation rooms. And those isolation rooms have ventilation that prevents recirculation of any airborne pathogen.
What I do is I screen everybody coming through our doors for COVID, for the actual risk factors regarding COVID. If I determine by the CDC guidelines that they've established thus far that they do warrant a test, we will send them out to our tent outside. If if they have symptoms but not ruling in for that, we'll send them on to registration. We've separated our waiting room into a respiratory side and a non-respiratory side. This is all in an effort to keep the virus contained outside of our doors as much as possible. Should anybody need emergent care, we would get them right into the back to be treated right away without a second thought in that, but we'd still maintain all our precautions. Excuse me. Because the biogen conference, they were right next to it. The biogen conference.
I understand.
Yeah.
That is